Hello friends, welcome to the show Talk with your Doc. My name is Dr.Prashant Jani. I'm your host today for this show. Increasing number of people are being diagnosed with the cancer. When I talk with my friends or family, we see one or other patient or family member is being affected with the cancer. And people try to find answers for the cancer through either internet search or through the available publications around them. It is not necessary that all such information which is published on internet is true, and many times such information can cause confusion. The research has found that if there is increased communication between the patients and doctors, it can improve the treatment and it can improve the patient-doctor relationship. Keeping that in mind, we have started this show, Talk with Your Doc. This series we are going to talk about variety of cancers, and today we are going to talk about commonly asked questions about cancer. And our guest today for this show is Dr. Margaret Anthes. Welcome, Dr. Margaret Anthes.
Thank you.
Dr. Margaret Anthes is a radiation oncologist at Cancer Center at Thunder Bay Regional Health Science Center, and she is a professor at the Northern Ontario School of Medicine. Thank you so much for coming here today.
My pleasure.
My question to you for today is that there are so many people being affected with the cancer. So please tell us about what is cancer and who gets the cancer. What is the real incidence of cancer in our society today?
Right. Okay, what is cancer? That's a very interesting question. Cancer is the name given to a collection of related diseases. Cancer is a disease that starts in our cells. Our bodies are made up of trillions of cells that are organized into tissues and organs. And all cells in our body have a certain job to do. Normal cells divide in an orderly way. Cells, when they are worn out or damaged, they die and new cells replace them. But with cancer, the cells grow out of control. And in all types of cancer, cells divide and grow without stopping and can spread to other parts of the body. Cancers can spread to other parts of the body through the bloodstream and also through lymphatic channels. This is known as metastasizing. Cancers can start anywhere in the body. An example of this would be lung cancer. Starts in the lung, but it can spread, for example, to the liver. When it spreads to the liver, it's still known as lung cancer because it starts in the lung and spreads into the liver. Whereas you can have a tumor that starts in the liver and it can grow there, or it can spread from there to other parts of the body. Now, you asked how common is cancer? Cancer is very, very common. In the United States and Canada, approximately half of all men and 1/3 of all women.
Wow, that's a big number.
Right, will develop cancer during their lifetime.
Half of the man.
Yes.
So every 100 people, 50 people will have a cancer.
Some type of cancer eventually in their lifetime.
That's a big number.
That is a very big number. Cancer is the leading cause of death in Canada and is responsible for about 30% of all deaths.
How about women? How many women get the cancer? As you say, half of the man will have a cancer.
It seems to be a little bit less. It's about 1/3 of women will develop cancer. To put the numbers into perspective, in Canada, it's a little bit over 500 Canadians will be diagnosed with cancer each day.
Wow.
And approximately 200 Canadians will die from cancer.
Every day?
Every day. Looking at statistics from 2015, we know that approximately 196,000 patients in Canada, people in Canada, I should say, were diagnosed with cancer.
Every year?
In 2015, and there were approximately 78,000 deaths from cancer.
Wow. So the cancer is really, really big in number. And
cancer is very...
Do you think, is it growing, the numbers are growing?
The incidence of cancer is increasing,
yes,
but the survival is also increasing,
yes,
which is very good.
And what is the age group distribution of this cancer? Like when we say man and women, increased number of are being detected, what is the age group of distribution?
Right. So 80% of all cancers are in people 55 and older.
Okay.
But anybody at any age can get cancer.
Can get cancer.
Babies can be born with cancer.
Cancer, right. So why do you think the incidence is increasing? What are the causes of this cancer which leads to increase in the incidence of the cancer?
Right. Well, there are many causes of cancer. We can divide them into a number of categories. In about 10 to 15% of cases, there's a genetic link to cancers, and these are caused by genes that we inherit from our parents.
So you get the cancer because your parents or a family member had a cancer.
Right, because there is an abnormality within the genes, that are passed on. Many people have heard of the BRCA1 and 2 genes linked to breast cancer,
Right.
also to ovarian cancer and other cancers like pancreatic cancer, and we even know prostate cancer now.
Right.
But in addition to that, that's fairly minor. There are lifestyle factors related to cancer, such as smoking, diet, weight, alcohol consumption.
Right.
Other things such as sun and UV exposure, particularly related to skin cancers.
Right.
There's radiation exposures.
Right.
And from this, it could be environmental, or it could be even medical radiation exposures.
Is cancer contagious? Can a virus infection transmit a cancer to you?
Yes, that was what I was going to get into next. There are definitely viruses that are associated with cancer. Hepatitis virus, HPV virus, and HIV virus.
So if one patient is affected with, say, HPV virus, human papilloma virus, and if that virus is transmitted, then your risk of cancer being increased.
Right. And definitely the HPV virus is associated with certain cancers. We know it's associated with cervical cancer, with genital cancers, anal cancer, and now there are many types of head and neck cancers, particularly base of tongue cancers that occur at the back of the tongue and in the tonsils.
Right. So HIV virus, is it associated with the cancer?
HIV virus is associated with certain cancers as well. Some of the cancers are rare, such as sarcomas, particularly Kaposi sarcomas.
Yes.
That is quite rare, but HIV is also associated with other cancers such as lymphomas.
Right. And can stress cause cancer? One of my friends yesterday was asking me, is the cancer caused due to stress?
Yes, people often ask that question. But what we know is that there is no scientific link between stress and cancer. Looking at a person's outlook and personality really doesn't cause a cancer. We do know that stress can have effects on the immune system, but many things have effects on the immune system. There have been studies done looking at this very thing, looking at stressors in patients' lives and determining if there is increased risk of cancer. And basically everything's been found. Some studies have shown slightly increased risks of cancer in people with major life stressors, such as the death of a loved one, a certain disease, something like this. Whereas other studies have shown no increased risk, and even other studies have shown a decreased risk of cancer in those that have life stressors. So now we would say there's no.
Very interesting. Thank you so much. So we will pause here for a break, and we'll come back to you with the questions on causes of cancer again in the next part. Thank you, Dr. Anthes.
You're welcome.